In 2021, we shot Meet the Streets, a documentary highlighting the lives of 7 individuals who benefited from the services at St. Vincent de Paul on the north end of Main Street in Middletown. These folks had at some point in their lives experienced homelessness, mental health challenges, and/or addiction. Several Middletown residents who had watched the film asked if we could shoot a follow-up showcasing the support services available in Middletown. We started on the north end with St. Vincent de Paul, which offers many services, including the soup kitchen and Amazing Grace food pantry.
My name is Mary Ellen Chuckrow. I'm the Executive Director of St. Vincent de Paul, Middletown. We are in the north end of Main Street in Middletown and have been a frontline organization here for 44 years. Principally here, we have different sites. So the building we're in here is the oldest. This houses our frontline soup kitchen, which is a traditional soup kitchen serving 3 meals a day, as well as what I call basic needs emergency services of food, clothing. We have outreach workers here, and this is the population we serve here, is where most people that are homeless come first. And then we triage and work with individuals to get them shelter, get them housed, get them treatment, either for mental health addictions, healthcare. So we're sort of a hub here for the community where someone in crisis, i.e. homelessness, addictions, mental health, all kinds of struggles in life will come first to find assistance. The upper 2 floors here house our administrative staff, as well as we have a pretty robust supportive housing program here, both scattered site and dedicated site. So our scattered site supportive housing staff, that's where we house people that are homeless in apartments and provide wraparound support services so they remain successful in housing long term. So we have about 51 apartments that we rent in the community, and there are staff upstairs that service those. We also have a homeless outreach specialist in partnership with Columbus House. That position is housed here, and that works with the little homeless up to getting them housed and a warm handoff to another agency for supportive housing. We have 2 populations. Amazing Grace serves more low-income families, where the soup kitchen serves more people that are very indigent and live at 25% below the poverty line, and who often are homeless on top of that.
Would you say that most people discover you because they need a meal, and then that's an entree into what you offer?
I think so. I think that's always been the main driver here, is come in and have a meal, and then start talking to our staff and our outreach worker and finding out what your needs are. What we were 44 years ago, the core programs are still in place. Populations have changed. Most notably here in the soup kitchen, I think the opioid pandemic is very serious, where 44 years ago people would die from long-term alcoholism. People are dying much younger now of opioid overdose and associated illnesses that opioids bring on, such as malnutrition, body wasting. Fentanyl is a big issue, but now there's a drug called xylazine, which is used in veterinary medicine, and it's often cut with heroin and cut with other things. And what it does is it finds an injection site or a wound, it opens that wound, and actually it sort of eats your bone, and you actually have to have limbs amputated. So, we're seeing a huge amount of opioid use, addiction, and we've targeted a lot of our services here. Our biggest news is we are building a new facility behind us on Liberty Street. We have bought 3 consecutive lots, and we're building a 24,000 square foot facility, which will be a continuum of services It will have a permanent warming center for the city in the basement, the lower level, I call it. It will have a full hygiene suite that will be open year round, which is showers, bathrooms, and laundry for the homeless. The soup kitchen and kitchen will be on the first floor. The next 2 floors up are 8 units each of permanent supportive housing apartments for the homeless. And then the top floor are these 2 floors, which is our administrative and scattered site housing projects, will be the top floor.
I'm wondering if you can give any advice for folks that are wending their way through town and encountering folks from this population who may be congregated with other people. And
When you look at the people we serve here, most notably at the soup kitchen, you see people sitting outside, gathering in places. What drives that is idleness and isolation. And it's seen by the general public as a negative thing. And I understand that. And so, Main Street has really been redeveloped, including the North End. We've got a lot more businesses up here than we have. And so I believe that everybody needs a purpose, no matter what your lot in life is, whether you're you or I or one of my clients. And I believe in giving back. So we've done a couple of things here. We have a clean crew every week that cleans Main Street. The individuals sign up. A staff member takes them down the street, up the street. They clean all the storefronts, the sidewalks, and the gutters. And it could be a homeless person, it could be an addicted person, it could be a mentally ill person that's on that clean crew. But what that does is it shows our community that we care about them, that we are not the detractor, that we want to be positive, and they're doing a positive thing. We've been doing that for almost 3 years now. And the Downtown Business Association pays for the gift cards, and we only do Stop and Shop cards. They get a $10 card for an hour of work. So 10 or 15, I can't remember what it is. So we've been doing that. The other thing we've done is we've hired, which is paid now through the city, a street outreach manager. He works Thursday through Sunday at peak business hours, and he basically engages people that could be intimidating or panhandling or intoxicated or whatever, by getting them help, by mitigating the situation, and making sure all the businesses feel secure. So his cell phone is tied to every business on Main Street. If there's an issue in a store, in a restaurant, he's on duty in the weekend, boom, he's the first call. So what does that do? That mitigates a police call. He also has direct dial to the police department. We have a social worker through the city on patrol cars now, and he works very closely with them in doing that. So that has been very effective in mitigating what some people see as negative behavior. But, they're people. They're people that had mothers and fathers or have mothers and fathers. They're brothers and sisters. They are parents many times. And they're people. And they're not bad people. They're not ugly people. They're people that need care. And that's what we're about. We try to offer hope, one person at a time. And if we can get one person into recovery, if we can get one person housed, if we can get one person in the shelter, that's one less person we have to worry about on our streets. And that's why we're here, and that's what we do.
excellent, thank you. Volunteer opportunities for the average Joe that wants to give back, as you say.
We absolutely could not do what we do without a very large, robust volunteer program. You can volunteer in the soup kitchen any day, Monday through Saturday, from 8 o'clock in the morning till 2, doing a variety of things, helping our chef and our staff, make sure the meal is out and cleaned up and all of that. Amazing Grace, I only have 3 staff there. And we're open Monday, Wednesday, and Friday. We're there 5 days a week, but shopping days are Monday, Wednesday, and Friday. We serve over most days between 85 and 130 shoppers. So there's a host of jobs over there, from working in the warehouse to helping people shop to running the front desk. We have a separate group of volunteers that do nothing but the backpack program. They come in and they get all that food ready to be delivered. So that's available. You can volunteer in our recovery services with our students. We can always use some extra help there. You can be a board member. We're always looking for some really great board members. So there's lots of different ways you can become involved with us with whatever time you may have.
The Center for Key Populations, under the auspices of the Community Health Center, provides primary care and social services to members of our community who otherwise experience barriers to care due to stigma and discrimination.
My name is Casey Harding. I'm the director of the Center for Key Populations here at Community Health Center. And what that is I run anything that kind of doesn't fall under primary care, falls under me. So our Healthcare for the Homeless programs, our substance use health programs, we have a large Ryan White HIV program, a migrant farm worker program. So any of those programs that serve vulnerable populations fall under the Center for Key Populations. I think when I think about how the average person can help, I think it's less complicated than people imagine. I think part of it is, having an understanding of where people come from and how they got to where they are. So for me, it's all about, when I look at someone, I think that it could be my mother, it could be my brother, it could be my cousin. And it's really important that we just look at people as human beings and those basic needs that happen and kind of try to suspend our judgment. I was just working with a guy who worked for Aetna, and they went to virtual, they were working remotely. And then they brought them all back to work, but his circumstances had changed. And through just a series of things that he didn't anticipate, he now had his car, and that's it. And he was living in his car when they brought him to the shelter. And, I think things like that, people don't understand how realistic that is, that can happen. And so when you're walking down the street and you're thinking, avoiding eye contact or things like that, I think we have to open ourselves up to look at people as human beings and understand that everybody needs housing and food and health care. And as a society, we have the ability to give those things to people. An example is just we give out Narcan. And we really want everyone to have Narcan. And people are like, oh, of course you're a proponent of Narcan because of what you do for a living. And I always tell people, I've used it a bunch of times in a CVS parking lot, at my kid's school. I've never used it in the homeless shelter or where people imagine I would. And so I think that's really that doesn't do a service to that resource, which is there and so important for everyone. So when we talk about the migrant farm worker program, one of the things last year we were awarded funding to get a mobile health unit. And this is this big, beautiful van that has a full exam room, a full consultation area, a place that you can do phlebotomy, a restroom. And what that allows us to do is, if you work in the migrant farm worker community, you work 12 hours a day, you work all the weekends. So what we do is on a Sunday at noon, when they generally get a little bit of a break, we pull our mobile health van up, and we'll provide primary care, HIV care, substance use treatment. And it's in a place where they're safe, where they are comfortable, where they don't have to find transportation and childcare and things. I'm famous for bringing a couple dozen donuts to entice them to come over to the mobile health unit. But things like that, really creative ways to reach out to people and to engage people in care are important to us. And I love that you're doing it on Middletown, because I think Middletown is an exceptional community. I think we have a lot of support. We have the Wesleyan students who are always willing. That's my first call when we need volunteers, is to call Wesleyan. And Middlesex community has been phenomenal in, directing people our way to help us out. So I think there's just, it's a great community, and I think we're on the cusp of something really innovative and good in Middletown, and we just need to get everybody together to support it.
My name is Valerie Smith, And my role here, I rehouse the folks that we work with that unfortunately fell under domestic violence. And when they leave their homes, they leave with nothing and nowhere to go. And our goal is to rehouse them so they can restart their lives. I remember working in the homeless field, homeless prevention. We had to make a decision whether a person had to eat or get a haircut. A lot of people don't realize that. You know, the decency of how people look when they go out to school to hold their head up high. People lose sight of that. So just talking with people, encouraging them to know that you still can have dignity even in the small things in life.
It's my understanding that you have some lived experience. Are you comfortable talking about that?
Yes, I am, because I'm not ashamed of my background at all, because it's lived in experience that get you to where you are today. If you have wisdom, education, and lived experience, you're like a fireball waiting to explode. So with wisdom, with my experience of where I come from, I could use that extra discernment. So coming up in life, we didn't have much. I've been incarcerated. I'm not ashamed of that because I learned to do better. You learn, it's when you don't learn from your mistakes is where you have the problem. So I was incarcerated for 2.5 years. It was because I was a substance abuser, hard drugs. I'm clean today, right? So now when I meet with people and they tell me they don't use drugs, I can smell it. I don't mean literally smell it, but I can tell by their actions. So I can better assist them. I don't have to say, oh, yes, you are, but I know how to talk to them so I can help them to get the help they need, right? But if I never was one knows their own, right? How could I help them? How could I talk to them?
Situated on the campus of Connecticut Valley Hospital is River Valley Services. RVS provides crisis intervention, case management, and residential and clinical services to adults who lack the financial means for services in the private sector. We spoke with Sarah Gadsby, River Valley's CEO.
Primarily, we are an outpatient. We provide outpatient services. We have, when somebody comes into care with us, they will go to our intake department, and from there is an assessment that is done to determine what level of care makes the most sense. So somebody could have really intensive case management services to more of a traditional outpatient need. We also provide respite services, which is here in this building, that provides an opportunity for people that might need some extra support in hopes to avoid a hospitalization. And then we also, or it could be a step down from a hospital, that they need just some additional supports. We have residential in place, and we also have our mobile response team, which is now operating 7 days a week, 24 hours a day. We were always 7 days a week, but we just were able to onboard our third shift clinicians, which is pretty exciting. And then in addition to that, we also have social workers that are embedded in the Middlesex Court to really support individuals getting treatment and avoiding, hopefully, any type of incarceration. And we also have, this is a relatively new program with the Middletown Police Department, where we have social workers embedded on first and second shift. Second shift we got about 9 months ago, but that has also been, I would consider, very supportive of the kind of the community outreach work that we are trying to do.
If there's a 911 call and there's clearly a mental health component to it, then the social worker is brought in to assist?
Yeah, there's I mean, they will pretty much, the police obviously want to ensure that the scene is safe, but then absolutely, then the social worker will come in and provide an evaluation. So our mobile services are 24 hours a day, 7 days a week. When somebody is struggling in the community, they can call the mobile response number. The direct line is 860-344-2100. At the time, a clinician, they're all licensed clinicians, all 3 shifts, will speak to the individual and determine if it will go out actually then into the community. It's actually been, the chief has reported in a couple of different venues that it has decreased the need for force by 30%, which is significant. So.
We spoke with Middletown's Mayor, Ben Florsheim, and asked him to talk with us about the housing crisis which directly affects the homeless in our city.
So I am newly a part of a statewide coalition that's looking at disconnected youth and disengaged youth. And we just had our first statewide meeting, and one of the things we heard from the president of the United Way, who was a speaker at this event, Lisa Tepper Bates, she came from the Connecticut Coalition to End Homelessness, and she was highlighting the service coordination that has been achieved in the last 10 years between agencies and services providing for people who are unhoused and who are seeking housing. That really is the model that is being looked to by other states when it comes to housing, and it's a model that we're now talking about using for trying to work with another population that's been very difficult to reach. And the real key is simply getting services working together as opposed to duplicating one another's services in different communities and sometimes within the same community. And we're at a juncture now in Middletown and as a state where there have been a lot of successes with a broad swath of the population that had been encountering homelessness, but we are dealing with 2 new kind of crises, or 2 crises that have been exacerbated during that same time we've made all that progress. One is cost of living continues to increase just all over the state, and that is driven by a lot of factors, and we need to be addressing that. And the other is just an increase in people who are dealing with mental illness and substance use disorders, and people who might have been housing secure before and not in need of these services, all of a sudden needing housing and potentially having a very different set of needs than we are used to addressing as a coordinated access network. So we have come such a long way, but we have to. I don't think we need to reinvent the wheel at this point, but we need to start thinking about a very different population, and that's what we've tried to start doing here in Middletown. There have been models that have, again, sort of been proven to work effectively for different populations over the last period. Permanent supportive housing works for some folks. Section 8 vouchers works for others. We are kind of unique in Middletown. Our Y is the last Y in the state to have single room occupancy for men, in which that's sort of the original purpose of a lot of YMCA's all over the country. Of course, they have now expanded in their mission and in their purpose, but that housing lifeline with 62 units is kind of a unique model that serves a population that is not effectively served by other models. We were just this week announcing we got a federal earmark from Congresswoman DeLauro for expansion at that building and that facility, so we're really excited to invest.
The Root Center for Advanced Recovery is a holistic behavioral health center that serves over 5,500 patients across Connecticut each day. Methadone and other medications help people with opioid use disorders lessen their dependence on lethal narcotics while limiting the pain and other severe symptoms that can accompany withdrawal. Carefully dosed treatments have been proven to lessen people's chances of relapsing and dying from an overdose.
My name is Ashley Hickey. I am a Director of Operations here at the Root Center for Advanced Recovery. The first step is getting them in the door, and once we can get somebody in the door, we assess what's going to meet their needs the quickest way we can meet their needs, and oftentimes that's through medication. So when they come in and they are looking for methadone or Suboxone or some sort of medicated assisted treatment to assist with their substance use, we get them started on that first. And then using our harm reduction model, we try to meet the needs as the whole person in different areas of their life. And sometimes that's getting them connected to insurance because they don't have insurance to pay for the supports and resources that they need, or transportation barriers. So we'll connect them to maybe the bus line, or I think now it's called MTM, the Medicaid assisted for transportation programming. And then we focus on the psychotherapy component. So if it's IOP, intensive outpatient programming, if it's mental health groups that they need, if it's family support that they need, individual therapy, if they have children and their children are driving them nuts and that's why they're kind of spiraling, then we ensure that we can get their children connected to services or anybody else that might be in their direct environment and support that'll also help them. When someone is struggling from an opioid use disorder, immediately stopping that opiate, whether it's fentanyl or heroin, can kill them. And what that does when they immediately stop is their body goes into shock, and they withdraw and or sometimes they overdose. So what the methadone and Suboxone does is it helps to stabilize the body's need now for that opioid. Methadone being an opioid, being a controlled substance that we monitor here closely, we're able to get them to a point where they're no longer feeling any withdrawal symptoms or feeling any effect of that illicit opiate, so that we can then decrease that illicit opiate. So using a substance like methadone and Suboxone, it stabilizes medically with observation and assessment, so that they can then decrease the substances that they're using on the street that may be heroin, it may be fentanyl, it might be cocaine, it might be laced with something else, so that we can then get them on a path that will be safe and secure as a medication, just like any other medication that you would get at a pharmacy, to help them live a safer life out in the community. Some folks in the town believed that we were just bringing quote unquote junkies to their area, to their living environment, to their home, their residential, and or we were going to be bringing more drugs to the town, and going to be polluting the area with substances, and being in this field, living with, personally living with someone that struggled with substance use, it's hard to hear, because it's a disease just like any other, and the substances are already here. The drugs are already here. The mental health symptoms that lead to substances and or vice versa, it's already here. And what we're doing is opening up our door to provide a safe space for folks that are struggling, or folks that are living with somebody or know somebody that are struggling, to come in and have a resource and a place to sit and say, this is hard and I don't know what to do and I don't know where to go, so that we can help either provide that support and provide that resource and provide that treatment, or guide them to another location that will be able to be better suited for them. But now it's in one location. Now our doors are open, and now we're able to say, let us help you. And it took a while to get here, and it was hard to hear those things, but since we've been open, I think the nuances of it, the novelty of, we don't know what this is going to be and we don't know what this is going to become, we've been able to show the town and show Middletown that we are here just to help.
According to statistics generated from the United Way, 46% of Middletown residents fall under the category of ALICE, which stands for Asset Limited, Income Constrained, Employed. This is a financially precarious way to live, to say the least. We spoke with Peter Keast, who oversees the Amazing Grace Food Pantry on Stack Street.
A little bit about Amazing Grace Food Pantry. We are the largest food pantry in Middlesex County, and in fact in central Connecticut. We serve about 14,000 pounds of food a week to the community. Currently there's around 1,022 families that are using us. The federal mandate for getting federal food is that we provide 3 days worth of food per month, which is, 10%, let's say, of a family size, food. And during COVID, we doubled that. We were able to use some funding that we got during COVID to make it possible to provide 6 to 8 days worth of food to families by having them come twice a month. So this is a food pantry that does twice a month for all families, not once. It's been going pretty well. Somehow we find suppliers, like recently, there's a Freihofer's distribution center down in Milford that they're very fussy about their bread dates. So we'll pick it up before it expires, but we'll pick it up, 600 or 700 loaves at a time. And that will last a week here. I think there's altogether 9 grocery stores we pick up food at to keep this place stocked on top of what the food banks give us. Connecticut Food Bank accounts for about 40% of what we get. Another 30% comes from what they call food rescue, which is food before it goes bad. As long as we're willing to pick up, it works. And then maybe about the remaining 10 to 20% are donations from the community. Food drives, things of that nature. So, there are 2.5 paid staff here. I call it half a paid staff, not just legs, but half time, 2 full-time and 1 half-time paid staff. And we have about 65 volunteers altogether. Everyone you've seen so far in here today is a volunteer. They come in to stock when the place is closed. Right now, the population of Middletown is 46% ALICE, which is asset limited, income constrained, employed. 46% of the families in Middletown, almost half, fall into that category. And that means that we're busy and getting busier. Cost of food is up, and certainly incomes are not up in comparison. So a lot of the people that want to donate food do so because they want to ensure that they are actually nourishing somebody else. When you give money, you're always wondering, gosh, what are they spending it on? And I get that. But I will tell you that if somebody gives us $1, we can get a new loaf of whole wheat bread for that. You can't get that in the store, So if it is a choice between money and food, money will probably buy twice as much actual food than you can buy in a store to donate. So if your mission is to serve as many people as possible, financially the money makes sense. And you can specify that your funds are only to be used for food purchases if you do donate to this organization. The second thing I should mention that we do, it's a few years ago we discovered that one of the food banks had discontinued a weekend food nutrition program for kids. They're commonly called backpack programs. And for the backpack programs, Connecticut Food Bank down in Wallingford had a truck that would go to a school and they leave off a bag with 4 to 5 pounds of weekend nourishment. They canceled the program just prior to COVID due to financial constraints. So I asked Mary Ellen if I could find a way to fund it, if we could take that program on. She said, you fund it, you do it, which was very nice of her. So I found some funders and we started that program. We had 90 kids our first year. This last year we had 387 kids. What they were getting from the food bank previously was more consistent with food bank foods, where, a lot of processed stuff but we put in shelf-stable yogurt, shelf-stable milk, 2 kinds of low-sugar breakfast cereal, always have fresh fruit, and then either a fruit cup, pudding, applesauce, something on top of that, 3 or 4 kinds of protein and or Quaker oat bars. What else? A can of chicken or tuna, and 2 oversized dinner rolls, mayonnaise so they can make sandwiches for themselves, sometimes mac and cheese, things like that. But we put in 5 pounds for the elementary schools. And asking what we need now, this year for the first time we are going into the middle school and the high school. And the reason we're doing that is that a lot of our kids have graduated out of their elementary school into middle school and there's no food support there on weekends. It's complicated because middle school and high school kids are different. They are much more concerned about stigma, the idea of, here's the lunch line and here's the pay lunch line, they were different. So we're putting together a program we're calling Elevate, which has 3 components. One of them is to provide weekend nutrition in a self-choice model. So we'll be putting racks of food, I can show you what the racks look like down the road a little bit, but we're putting racks of food where kids can help themselves what they want, rather opposed to pre-packing. And we're inviting hosts from the community to actually, host the event, like a food court event. And the host, the mayor is going to be a host one day. 2 universities, Goodwin University is going to be a host one day. And what they're going to do is try to establish 1-minute mentoring opportunities with students. So the school system can announce, hey, the Elevate event this week is going to be in the library from 10 to 2. Well, from 10 to 2, Goodwin University's radiology program might be there. But the idea is to put something that elevates a student that might be struggling a little bit in home life with an opportunity they could focus on. We're also doing a feminine hygiene program, which is kind of odd for a 66-year-old guy to be talking about, but in the process of discovering what these students need, we've discovered something called period poverty that I didn't know anything about. There are a good number of families living in a situation where they cannot afford not only all the food they need, but also hygiene products for their daughters that are attending school. And the state's response to that is to mandate school systems to put a machine in a ladies' room, which is fine, but which will take care of an immediate emergency need for the next hour or 2. And then the student goes home, and then what? Then what? Do they not come in the next day? I mean, what? And I think that it's, personally, I think that's so close to discriminatory based on, random biology. It eliminates a lot of opportunities for young ladies, educational, extracurricular activities. We are, as an organization, really uncomfortable with that. So we're raising money right now so that when these food courts open, if a person is interested in personal hygiene products, they can scan a QR code, pick the products they want from a website, and we'll deliver it to the school the next week. It'll be a month's supply, not a single item to solve an emergency. When I got here, I realized the food pantry, okay, all these people were coming in the door, and I'm looking at the group and saying, this is clearly not all they need, because we're kind of like a pond, and the pond has all these different fish in it. And over the past few years, we have been inviting other organizations in here, such as Catholic Charities has an office in here right now, and they're very, very good at looking after the needs of young mothers. Baby formula, diapers, things like that. They also, when people come in, if they're not signed up to receive SNAP, Supplemental Nutrition Program, they can sign people up for SNAP, they can sign people up for WIC. If they are having other issues that there are entitlement programs available for, we're kind of a resource center for that. Last week, Middlesex Health was here doing a survey about the needs of the community, sitting out front. So we invite the free cell phone companies to come in and sign people up for those. Last year we hosted VITA, Volunteer Income Tax Preparation Organization. And we advertise it here. And last year VITA brought, I think, $850,000 in refunds to people through this building.
We thought we'd leave you with these words from Sarah Gadsby.
Understanding that, people don't grow up and say, I'm gonna grow up and have a substance, use issue and lose all of my family and all of my friends and become homeless, and that these individuals are somebody's family member, that they are someone's child, someone's parent, somebody that used to, really love and care for them. And the same with mental health issues. When if you see somebody that's, struggling or homeless, don't look away. Look at them, smile, and say hello. It's there's no, I'd make a point of looking people right in the eye and smiling, so they feel seen And, you know, it's just your daily, it's just a human part of the work, or being connected. People need connections.